The only one of the statements that's true is that we're looking at the lateral aspects. If she were standing in standard anatomical position, she would be standing upright. She's not prone because she's not lying face down. She's not supine because she's not lying face up. And the blue arrow is pointing to the thigh and not the leg. So in explaining the basic physics of radiology and how images are taken and interpreted, we'll be talking about exposures. But one type of exposure that you may have worried about if you've actually had an X-ray taken is the kind of exposure that happens inadvertently as a result of the fact that hospital gowns really don't fit anyone. And so those exposures, those inadvertent exposures, may be either anterior or posterior. So what we'll be considering first are plain film images. So now, as Anatomy X students taking this course, you can call them plain film images, you can call them radiographs, but you may no longer want to call them X-rays. A plain film image is created when energy from a radiation source passes through the body and exposes a photographic plate or creates a digital image on a detector array. So here we have a patient standing against the radiographic plate. Here's a very schematized radiation source. Here's the radiation beam passing through his body, exposing the photographic plate, and generating an image. Because the radiographic beam passed from front to back, the image generated is called an antero-posterior view. If we go the other way, so here's the patient standing against the plate, radiation source, very schematized, is brought in, radiation beam is generated, plate is exposed, and the image generated when the beam passes in this direction is called a postero-anterior view. Comparing antero-posterior, or AP, and postero-anterior, or PA, chest films, they would look virtually identical on this patient. The only time it matters is that there is some expansion of the beam as it passes from the source to the plate. So if you were particularly interested in, for example, estimating the size of the heart, you would choose a PA rather than an AP film. So this is what the PA film would look like. The next view will be a lateral view. So this patient is uncomfortably situated. Radiation source, the beam passes through the body, exposes the plate, and now we've generated a lateral image. So the beam has gone from one side of her chest through to the other side. The three image types that we've looked at so far, the antero-posterior, or AP, the postero-anterior, or PA, and the lateral chest film that we've just taken, are projections rather than sections of tissue. So when we were looking at making tissue sections and we looked at sectioning the egg, that was an actual slice of tissue. This is a projection in that the values of gray, the shades of black, white, and gray seen on the image, represent the sum of all the structures the radiation beam passed through between leaving the source and reaching the plate or digitizer. So everything is superimposed and on top of each other. So in some cases, we'll be seeing 2 or 3 organs on top of one another in this film. By contrast, a computed tomography image, or a CT, actually does represent a section rather than a superimposed projection. And it's actually more like the tissue slides that we looked at when we were talking about histology. So in taking a computed tomogram or a CT image, both the radiation source and the detector array will rotate 360 degrees around the patient. Once we've taken this set of images with the radiation source and the detector array rotating around the body, then the data generated by those images can then be transformed by the radiologist into sagittal or coronal reconstructions. Radiologists can even take those serial images and create a three-dimensional model of, for example, the aorta. So here's a CT image of the chest. And again, this is a section, a really thin section and not a projection. And we can see on this various shades of black, white, and gray. And you're probably wondering how we can use our knowledge of how tissues appear on radiographs will enable us not only to look more intelligently to see various structures, but also to learn something about their density. So in order to interpret them, we need to know a little bit about grayscale. So here's the radiation source. Here's the photographic plate. If nothing is interposed, like a patient, between the radiation source and the image plate, all the radiation beams will reach the plate. The entire plate will be exposed and will be uniformly black. So if the beams are passing through air only, then the plate, the corresponding portion of the plate, will be completely exposed and will appear black. Soft tissue, which is basically in contrast to calcified tissues like bone or teeth, even calcified cartilage, soft tissue, fat, muscles, organs, stops some of the X-ray beams from reaching the plate. And instead of exposing it completely, those areas that correspond to the soft tissue will appear in shades of gray. The particular shade of gray is determined by two things. First, the density of the tissue. So this is a block of fat shown in the diagram. Fat is not particularly dense, and so the portion of the plate will be relatively dark gray, maybe even a little darker gray than it's shown. Soft tissues like muscle and organs will absorb slightly more of the beams, and so the underlying plate will be less exposed. If, instead of being very dense, we have a thicker block of tissues, as we did in some of the radiographs that we took, then more X-ray beams will be stopped, not because the tissue is denser, but because the tissue is thicker. And so the density of a tissue, as well as the thickness of the tissue, will affect how much the plate is exposed. Bone is the second densest structure in the body, and so bone will stop most of the X-ray tissues. The appearance of bone on a radiograph is important for older people because in those with osteoporosis, the bones are less mineralized, and the image of the bone on the plate will be lighter gray rather than white or almost white, as in this tissue. And then the densest structures of all are actually tooth enamel and any metal that appears in the body. And so that can be a metal filling in a tooth, an amalgam filling, or an implant of any kind. If you've had a fracture repaired and they had to use a plate or bone screws, then those will appear very dense on a radiograph. Any joint replacement, and in the trauma setting, any bullets, for example, or fragments of metal will also have this very white, dense appearance. Quiz question. The density of the object indicated by the tip of the red arrow is most likely